Hello again, everyone. You're joining us for another episode of Executive Platform's Blueprint podcast series. My name is Geoff Micks. I'm head of content and research. My guests today are Martin and Søren from Novo Nordisk. We're going to be having a conversation about collaboration among industry peers to help the life sciences move forward without, stepping on toes in a competitive space. But there's a lot of good work that can be done to make everybody succeed. I'm so looking forward to this conversation. Gentlemen, thank you so much for joining me today.
Thank you. It's a pleasure. Thanks for the invite.
Why don't we start off by talking about collaboration in this industry? I think there are a lot of great opportunities for doing things that are not stepping on each other's toes, not revealing IP or things that shouldn't be shared, but definitely ways to move things forward. And I understand your company is interested in being a leader in this space. Let's talk a little bit about it. What do you want to do?
Thank you for that question. And we do think it's a good approach to see if we can collaborate more among peers in the industry. We, as the company, realize that a lot of the things we develop actually are not part of our competitive advantage. And actually, it's a benefit to join forces on setting standards together, right? We all remember the times when the different phones came out and they all had different charger systems, and it was really annoying for the customer. In our case, it's not just annoying for the customer, it's annoying for ourselves. If, for instance, the way we need to calibrate equipment depends on we can get a local supplier in country X or Y. So if we were more to develop the same kind of technology, maintenance, for instance, becomes much easier and also cheaper. So we see a lot of benefits of driving certain standardizations agendas together. So that comes to the regulatory, and Søren can speak much more to that, but also the technology standards or maybe even scouting technology together. So we would love to get more engaged with others and really look forward to people also come with inspiration they have had. Yeah. I'm not sure if you want to add to that, Søren.
Absolutely, and I think it's a very, very important question. One of the things that we always try to make very, very clear is that there are some guardrails. We would never talk about products, patents, IP rights, or patients, the way you treat patients, because that is something that is kind of proprietary, and we have competitive laws and what have you not. But as long as we are talking clear technology, QC technology, manufacturing technology, we are actually able to share everything, and we have a clear interest in doing so. The technology that we talked about today was the test for sterility. And if you make aseptic manufacturing, if you do products for injection, everybody has to make a test for sterility. And the current test is very cumbersome, very resource intensive. It takes 7 to 14 days. So what if we together could develop a new standard for making test for sterility that took like 3 minutes? Instead, that was much, much cheaper, quicker to do, and by the same token actually gave us a ton of information about the process. So for me, that would be a win-win-win situation. But as Martin alluded to, we cannot do that by ourselves. We cannot make a Novo Nordisk standard for test for sterility. We have to work with our peers and look at everybody and say, okay, if we go that way, could that be a way we could approach the regulators, the pharmacopoeias, the national regulators in making a standard? And these things take time.
Mm-hmm. Mm-hmm. And just adding to this, right, I work in the area within aseptic manufacturing, technology innovation. So what we try to do is identify new technology, mature it, get it approved, pilot it, and then push it out to the production lines. And we are not a producer of filling lines, right? So someone else does it. Their manufacturers produce these lines. So if we come with a particular way that is really beneficial for our needs, and then we ask the supplier to build this for us, it is way easier if more of peers have the same idea, right? What if peers come with like a different solution to the same problem, it becomes really complex for everybody. So why don't we join forces in things like this? Because it makes it much easier, right? And we can even think beyond that. The technology we also talked about today is actually something that was developed for military use. so outside of the pharma world. And some of our really brilliant scouting experts found this technology and thought we could adapt this to pharmaceutical use. And the technology was not developed for it. So the art we put into it was to get the right comparability studies, the right non-inferiority studies to actually get the health authority approvals. What I'm trying to say is that if we think broader, right, then it's not just peers. Maybe in my particular case, we need to think of aseptic manufacturing as a field that is used with semiconductors or with dairy products or what have you. Anywhere where aseptic manufacturing is an essential part of it, they probably all have good problems. They solve with good solutions. Why don't we chip in? There's even peers we don't even slightly compete with because they produce something completely different.
And there's a very, very valuable lesson in here as well, because one thing is the peer-to-peer cooperation. That is, of course, very, very important. That is kind of the driving force. We have the push to market. But we actually also have the regulators and the standardization organizations in there. Because if they are not part of this overall movement, we won't get anywhere. So big praise, for instance, to the US FDA for making the Emerging Technology Team, ETT. It is actually stipulated very clearly on their website what they do. And recently, the European Medicines Agency, or EMA for short, has actually made a quality innovation group where they start up introducing what does it take to get new technology approved in manufacturing and QC for the pharmaceutical industry. The Americans are a little bit further down the road. They've had some years where they have worked with this, been very successful in introducing new technologies. They state that on their website. With regard to Europe, the Quality Innovation Group is fairly new, and they are right now instigating listen and learn focus groups where they, together with industry, go through new technology. What does it mean to use AI for manufacturing? These new platform technologies, what can we use them for? Which aspects of validation do we need to talk about here? So it is not something you can take to the bank, but you talk with the regulators. What do we need to consider? And it's also a very nice way for the regulators, without kind of getting nailed to the cross, to ask questions and get into a little bit of the weed of the things without having to be very, very cautious. We just sit down and, like scientists to scientists, we just talk about what is important here. And I really, really enjoy that approach because it kind of takes the antagonism out. We are not talking about a new product. We are talking about a new technology. And in the US, that has worked very well. And with regard to the Europeans, they have now, I think they've made 4 of these focus group meetings, and it has worked exceedingly well.
I would love to expand upon the focus groups a little because I think everyone can acknowledge every company doesn't need to come up with their own solution. You don't need to invent the wheel 70 times, then see which wheel works best. But in these focus groups, how are they identifying which good ideas are a little bit better? How are they deciding this should be the standard? It feels like the sort of thing that either is going to take a ton of time or there's going to be a ton of differing opinions because everyone thinks that their solution is probably a very good solution. They want to lobby for it. How are they making decisions and how are they getting buy-in from others?
We actually miss the part that actually can answer that question because, to be honest, I don't know. But the way it works is that, for instance, for the 4th round of focus group meetings, EMA issued that we would like to talk about platform technology. And then they make a description of the problem at hand, actually a rather detailed description. What is it we would like to talk about and what is it we will not talk about? That's just as important. And with this very detailed description, it's like basically when you submit an abstract to a conference, everybody thinks they have the best presentation, but somebody has to make a decision. And I think it's probably fairly subjective, but also very political, because the agencies will probably choose topics that they deem are very important to them, to patients, to drug shortage prevention, and all these issues. So is there a clear objective standard for choosing? No, there isn't. We are talking, these are human beings, And of course, there's an element of subjectivity to that. But since they continue to make these focus group meetings, there's a good chance that everybody at some point in time will get a seat at the table.
Mm-hmm. And I understand you also like this, that competition is, generally speaking, a good thing, because it brings up like not just a solution, but hopefully the best solution, right? And I agree to that. And also being at this conference here these days, it is very interesting to see that something that maybe is just become a commodity for us as Novo Nordisk, because we need a certain way of solving a problem, maybe is what different companies compete on, right? Yeah. Whatever, how to implement a new data structure, whatever, is maybe something that we just need, while others compete on doing it the best way. So I get your point that how to ensure the innovation doesn't suffer because we kind of standardize everything. But I think that would be overstretching what we are trying to achieve here. I think it is more to say, we were talking about this particle counter, that this is a thing that we mature, and we would love to use it, and we benefit if more people use it. Right? It's if you have a car and someone builds one road, you can only drive thus far. But with more people buy cars and buy roads, then we all can use the same roads. So that's the purpose of infrastructure, right? So I think these are the areas we've talked about. And if you think about it, in with regard to international standards, right? I worked with devices, so the pen standard, the 11608. Right, so different companies sit around the table, and to create the next version of the standard, they have done this for decades. Correct me, Søren.
Yes.
And how shall we do? What do we propose in the standard of how you test a pen, the dose accuracy, whatever, right? And here we already sit together and try to define that together, because. You still need to execute the test yourself, right? We just try to get some common ground and some, again, I use the same word again, standards on how to do it. And I think
but you actually raise a very, very important point before with regard to innovation. Because if we take the area, for instance, on cell and gene therapy, which is kind of the new black, at some point in time, the International Conference on Harmonization, ICH, which is kind of a global corporation of regulators, they talked about making a manufacturing standard for cell and gene therapy. And at the time, that was in 2020, 2021, the conclusion was actually that was too early, because you risk stifling innovation. Because this new technology on cell and gene therapy is more than just a progression of existing technology. This is qualitatively something completely new. So you basically risk just making a lot of guardrails on a new technology, which is based on the old way of thinking. Whereas if you think, okay, let's give this 4 or 5 years, and then we can talk about it. So what ICH did was that they made a cell and gene therapy discussion group. It really sounds uber nerdy, but it's basically a group of people like we do here that sit and talk. How can we, for instance, standardize cell and gene therapy in such a way that we are not too descriptive, but in a way that it still has an element of standardization and thus protects the patient. It's always a very fine balance. In industry, we are normally not very interested in very descriptive guidelines, because it kind of stifles our way to do with our suppliers, what we want to do, our values and what have you not. Whereas if you have some principles that you have to live up to, that is something completely different. It's always a balance. Sometimes you have to be very descriptive, and sometimes you can be a little bit more flexible. But I think the area of cell and gene therapy was actually a very good example, where the regulators at an early point said, okay, this is too early. Let's give it a couple of years to see where this is going. And you can just see at this conference that we are on here today, it's kind of cell and gene therapy all over. And from year to year, it develops, and I can guarantee you it has developed in a different way this year than we thought a year ago that we would be. So this is really, really it's a fascinating time to be alive, as one said. So we are looking forward to that.
Yeah.
So I definitely take on board your point that you don't want to standardize so early that companies don't get a chance to make the innovations they need to succeed. Mm-hmm. And I also think there's something to the argument that just because we are standardizing doesn't mean you can't go a little outside the norm for your very particular needs. I mean, if you get 70% of the industry saying we want to do it this way, that is still enough to drive down costs, to help with access, supply chain, and then that other 30% of the market can be serviced by people who say, hey, your particular treatment or therapeutics or whatever it is needs to be a little different than the standard. This is how we're going to help fill that need. There is that part of the conversation of standardization, which is not to say you don't standardize it. You do standardize, and then you make room for exceptions and growth. Yes.
Yeah. And it's very important to remember that standardization is still the key to commercial success. If you take the really, really big innovations, the compact disc, the DVD, VHS video cassettes, the computer, mobile phones, if you look behind all these inventions, it's a strong element of standardization, because that will enable global manufacturing and global selling of these products. So at some point in time, it was also discussed, for instance, in the Danish Association of Dansk Standard, which is a local association in Denmark, where we talked about, do we, for instance, need to start on standardization of AI?
I would love to add to a different thought on the competitive advantage and disadvantage of standardization, right? As you mentioned earlier, and at the opening panel yesterday, some of our fellow people here mentioned that the future of biomanufacturing is collaboration with industry. And I think there was a particular aspect they talked about here, and that is to say that we all compete on our core competencies and not on the side competencies that we need to have in order to focus on the core competencies. So, and the point that the speaker made was that if we dilute our focus too much away from our core competencies, because we need to all focus on the side stuff, actually the innovation bar will decline, right? So what if the commodities, as I called it earlier, that is kind of agreed upon or made easier at least, and then we can focus back on our core capabilities, core competencies, instead of everybody. I mean, you mentioned AI, right? If all the companies now try to get the different aspects of AI on board, we all use the same resource, we all compete on the same employees, we all compete on the same new settings. If that were standardized a little bit, we could all use a little less, and maybe this particular technology becomes a little less a bottleneck, and we can all come back to focus on what we're here to do, which is in Novo Nordisk's case not AI, right? If AI helps us, great.
It's a tool.
It's a tool,
yeah.
like so many other tools. And I think that could ease the pressure on some of the critical tools we have, and then we can come back to innovate what we're really good at, right?
I think a lot of people who have been listening to this conversation would probably wish they were contributing to it. I think there is an idea that a lot of good input needs to be made into this conversation for good ideas to come out of it. So I guess what I'm asking is, how can different industry players collaborate? How do they get involved? What is the way to actually make an impact into this topic?
There are many ways that you can do that. One of the ways could be participating in conferences like this, where you would talk to your peers. But another way, and a way we really use a lot in Novo Nordisk, is by engaging in peer-to-peer networking in PDA, in ISPE, in IQ Consortium, in Bioforum, in FPEER, in Pharma, and Bio, and a host of these other technical organizations, and then join the work groups on aseptic manufacture, on AI, on visual inspection, and what have you not. In these particular work groups, you really get into the nitty-gritty and the weeds of things, and that is where you actually talk with your peers on how can we improve this. And right now, all of these organizations I just mentioned are creating work groups on AI. And they all give it their particular flavor of what is important to FPA, the European Association, what is important to the American Association. And if you take ISPE, they are looking more into the engineering aspects, whereas PDA is maybe more looking into the pharmaceutical technical aspects. So everybody comes from their particular angle and gives their version of the problem. And all the versions together actually form the reply to the question holistically.
And if I understood you correctly, the question is, what can we do? What would be a first step, right? Last week I was had a dinner with a supplier or co-developer of future technology back in Copenhagen, a French company, and the person I spoke to mentioned that he was surprised how quick we were to engage on a level of trust, right? With that company. And I think it is a little bit back to what Søren said in the start. We know what we do not want to share, right?
Exactly.
So if we're clear about this, and then we also know what we can be transparent about, and that makes it much easier than to go out and start conversations, right? We are at a level where we talked about, look, you're developing some kind of technology. We would like to see that technology not just applied with us, but maybe in an equipment we buy elsewhere. Would you be comfortable with that we meet as with the other supplier, and then we can make not just a co-development, but the three of us? And maybe a first step, coming back to your question, could be to say, be clear on what you don't want to disclose, and then
there's freedom in having some limits about, okay, definitely not this, but everything else. Yes.
Yeah, exactly.
Well-defined ground rules.
Yeah.
Some organizations are very formal about that because there are legal aspects to it. But what I find really, really interesting and actually very, very nice is that we basically know all the players in the other companies, and we have known each other for years and years and years. Of course, there are new players that come into the field, but we trust each other because we know that the moment somebody falls out of line and delivers something that is not scientifically sound or viable, they are not helping industry. So we are all in this together, and we are only as good as our competitors are. So this is really a joint effort. So it doesn't matter which company you are, as long as you provide good science, you can be part of this discussion.
Yeah,
I think that is such a great note to end on. I think it's a declarative statement that lays down the principles in a very clear and logical way. I know we could have this conversation all afternoon, and I would love to do that, but I also want to be very respectful of your time. Martin, Søren, thank you so much for joining me today.
Thank you so much for the invitation.
Yeah, thanks for inviting.
For anyone who wants more of this, these gentlemen did a presentation on this topic a little earlier today, and we're going to be including a link to what we are allowed to share in the show notes. Again, thank you so much for your time. You've been listening to another episode of Executive Platform's Blueprint Podcast Series. I've been Geoff Micks. Let's do it again soon.